This is going to be a review of medical terminology, all 11 systems of the body, and it's also going to be a review for relevant anatomy and physiology related to these terms. The first term, and what I'm going to do is pronounce the term, and then you will rate the term. The first term is adenohypophysis. Adenohypophysis. That is going to be the anterior pituitary gland. The pituitary gland itself is the master gland. It secretes multiple hormones which have effect on other glands throughout the body. And the term, once again, is adenohypophysis. Adenohypophysis. Alveolus. Alveolus. The alveoli are the tiny air sacs that make up the lungs. The lungs are made up of millions upon millions of these tiny air sacs. One individual one would be an alveolus. The term again is alveolus. Okay. Coronal. Coronal. That typically refers to the coronal plane, which divides the body into a frontal portion or anterior portion and a posterior portion. So we have anterior and posterior. We call that the coronal plane. You may also hear the term dorsal, meaning back, and ventral, meaning front. But the coronal plane divides us into a front portion and a back portion. Okay, again, the term is coronal. Endocrinologist. Endocrinologist. The endocrine glands are the glands throughout our body that secrete various hormones. For example, the pancreas secretes insulin and glucagon, which help us to metabolize glucose. The physician that works with a patient's glands is called an endocrinologist. Again, the term is endocrinologist. Antipsychotics. Antipsychotics. Antipsychotics are going to be medications used to treat patients with psychotic episodes, particularly schizophrenia and bipolar. So those are going to be medications used to treat patients with those mental disorders. Again, the term is antipsychotics. Antidiuretic. Antidiuretic. Antidiuretic, it may refer to antidiuretic hormone, which is a hormone which keeps us from producing as much urine. Therefore, we maintain our body water. The human body is over 65% water, so it's important that we maintain our homeostatic set point of water in the body. And one way that we do this is by decreasing the amount of urine produced and holding on to body water. So in this case, a hormone like antidiuretic hormone would keep the body from secreting urine in vast amounts and maintain water balance. Again, the term is antidiuretic. Ethmoid. Ethmoid is going to refer to a bone, and it's a facial bone. Okay. Okay, the ethmoid bone is going to be a non-paired bone that makes up, again, our facial structure. Okay. It can be seen from, if we take a section of the skull off, we can see it when we look down into the skull. We can also see the ethmoid bones on the side of the skull in our skeletal model. Okay, again, the term is ethmoid. Ethmoid. Gastritis. Gastritis. Gastro means stomach. Itis, of course, means inflammation. So in the case of gastritis, this term would mean inflammation of the stomach. Gastritis. Myringotomy. Myringotomy. Okay, myringo is a combining form that means tympanic membrane. The tympanic membrane is our eardrum. Sound waves bounce off of that, causing the bones of the inner ear to vibrate, and that leads to our ability of the vestibulocochlear nerve to transmit those impulses to the brain, and then we perceive sound. Myringo again means eardrum or tympanic membrane. Tomy is a suffix which means to make an incision. If a patient had a middle ear infection and there was fluid buildup in the middle ear, they might need to have a myringotomy. Okay, again, the term is myringotomy. Eclampsia, eclampsia. Eclampsia is going to be seizures associated with pregnancy or shortly after pregnancy. You may also hear a term similar sounding to this as preeclampsia. Preeclampsia would be hypertension during pregnancy. But the term that we are looking at now is eclampsia. Eclampsia. Dysmenorrhea. Dysmenorrhea. DYS we know means difficult or labored. Meno means menstrual or menstruation. Rhea means discharge. So this would be a painful menstrual discharge. The term again is dysmenorrhea. Aged. Aged. Aged means a specific range of age. For example, males aged 14 to 18. It is dealing with a specified age range. Again, the term is aged. Aged. Cardiologist. Logist is one who specializes in. Cardio means heart, so one who specializes in the heart. Cardiologist. Again, the term is cardiologist. Differential. Differential. Typically, we hear this term associated with differential diagnosis. And what differential diagnosis would be the final information which distinguishes one particular disease from other diseases that may have a very similar pathology. Okay, so again, differential in this case meaning the difference between multiple diseases which present with similar signs, symptoms, and an overall similar pathology. But in this case, the term is differential. Differential. Urethra. Urethra. Urethra is the tube that leaves the bladder that carries urine out of the body. In males, it's considerably longer than the female because the male urethra has to make its way throughout the length of the male penis. And in the male, the urethra is also going to deliver sperm from the seminal gland during ejaculation in the attempt to get a female ovum fertilized and produces zygote that implants in the uterus, the endometrial layer of the uterus, and therefore leads to pregnancy. But the term is urethra. Urethra. Carcinogenesis. Carcinogenesis. Carcino means cancer. Genesis means producing. So carcinogenesis means producing cancer. Our term is carcinogenesis. Carcinogenesis. Lymphadenectomy. Lymphadenectomy. A lymphadenectomy is removal of multiple lymph nodes associated with malignancy or cancer. So lymphadenectomy would be removal of lymph nodes when a patient has cancer. Okay, the term again is lymphadenectomy. Diagnostic. Diagnostic. Diagnose is to make a decision about a patient's condition. Okay. IC means pertaining to. TIC also means pertaining to. So diagnostic would be pertaining to a diagnosis. And again, a diagnosis is going to be deciding, once all relevant data is accumulated, deciding what the patient's condition is. Okay, again, the term is diagnostic. Diagnostic. Abdomen. Abdomen. Okay, the abdomen, of course, is beneath the diaphragm. That is where the organs of digestion are going to be located. Again, the term is abdomen. Abdomen. Brachytherapy. Brachytherapy. Brachytherapy is going to be the introduction of a very small amount of radioactive material, typically they call it a radioactive seed, in the area of cancer, or maybe even inserting it into the cancerous tumor in order to provide pinpoint radiation to that tissue to destroy the cancer. Okay, again, radioactive seed is placed beside the tumor or even inside the tumor in brachytherapy. Okay, brachytherapy. Cholecystectomy. Cholecystectomy. Cholecystectomy is going to be removal of the gallbladder. Okay, cholecysto is the combining form that means gallbladder. So cholecystectomy, the suffix ectomy meaning removal, it's going to be surgical removal of the gallbladder. Gallstones are often the culprit for this surgery. Again, the term is cholecystectomy. Anemic. Anemic. Anemia is typically associated with a low red blood cell count. Red blood cells carry oxygen. If somebody is anemic, they are not going to have much energy because every cell in our body needs oxygen, and a low red blood cell count is going to lead to low oxygen to all of our cells and all of our tissues. Anemia could also be to low iron content of our red blood cells. That also is going to decrease their oxygen carrying capability. Again, the term is anemic. Anemic. Phagocytize. Phagocytize. Phago means to eat or swallow. Cyte means cell. Okay, a phagocytic cell is going to destroy other cells by engulfing them. If you look at it on a video, it looks like they are actually eating pathogens, a bacteria, a virus. So the action of phagocytizing would be to engulf or eat a foreign particle or pathogen. Okay, again, the term is phagocytize. Phagocytize. The term is otorhinolaryngologist. Otorhinolaryngologist. An otorhinolaryngologist is an ear, nose, and throat specialist. Oto means ear, rhino means nose, laryngo means larynx, and in this case, the voice box is the larynx. Logist is one who specializes in. So an ear, nose, and throat specialist. Otorhinolaryngologist. Anxiety. Anxiety is a disorder. It may be referred to as major anxiety disorder, in which a person has an unhealthy fear or level of overall anxiousness, which keeps them from doing activities associated with daily life. Okay, so the term is anxiety. Anxiety. Chlamydia. Chlamydia is a sexually transmitted infection, and it is going to be a bacterial infection. Ultimately, bacterial infections can be treated with antibiotics, and therefore chlamydia is treatable with antibiotic medication. But again, the term is chlamydia. the sexual transmitted infection, chlamydia. Antibody. Antibodies are going to be immunoglobulin proteins. Immuno means immune or to protect. Globulin is a shape of protein, so they are immunoglobulin proteins which help us by destroying foreign pathogens. Specific antibodies are created by our body in response to various pathogens, and they destroy the pathogens by interacting with a specific pathogen. So each pathogen would cause our body to create a specific antibody. Again, the term is antibody. Collateral. Okay. Collateral is going to be a subordinate or secondary structure. For example, if we are talking about collateral circulation, if this is a coronary artery that becomes blocked due to atherosclerotic plaque building up, this area of the heart would not receive blood because of this blockage. What we would see are secondary branches off of this artery start to actually grow in size and in number to help nourish this area of the heart. So collateral means secondary or subordinate to a more main structure. Okay, the term is collateral. Diabetes mellitus. Diabetes mellitus is an endocrine disease, specifically where the patient either produces no insulin, that is known as type 1 diabetes mellitus, or type 2 diabetes mellitus. That's typically associated with still producing insulin, but the insulin is no longer effective. Okay, type 1 diabetes, that refers to no production of insulin. Type 2 diabetes, insulin is produced, but it's no longer effective in managing blood sugar levels. Okay, the term is diabetes mellitus. Geriatrician. That is going to be one who specializes in working with older adults. Geriatrics is the study of the older person, and a geriatrician is one who specializes in working with older adults. The term is geriatrician. Keratin. Keratin is a hard protein that is found in our skin. It's also what makes our nails hard. It also is found in our hair and gives hair its strength. Okay, keratin again is a protein found in our integumentary system. We find it in the skin, the hair, and the nails. The term is keratin. Bariatric. Bariatric typically refers to a procedure to reduce a patient's weight because their weight is having an adverse effect on their health. So a bariatric procedure is a procedure to reduce a patient's weight for health reasons. It may be a lap band procedure, it may be gastric bypass. The term is bariatric. Endocardium. The endocardium is smooth epithelial tissue inside the chambers of the heart and of the valves of the heart that allows the blood to very smoothly move through the various chambers of the heart, the atria and the ventricles. Okay, the term is endocardium. Debridement is cutting away dead necrotic tissue. Necrosis means death, and debridement is going to be cutting away necrotic tissue until you get to good, viable tissue. You may see this performed in patients that have decubitus ulcers. Another term for decubitus ulcers, of course, are bed sores. And bed sores would require debridement to cut away necrotic tissue to get to good tissue so the wound would heal. Again, the term is debridement. Debridement. Benign. Benign. This refers to a tumor which is non-cancerous. Cancerous tumors would be malignant. Okay? In this case, we're talking about a non-cancerous tumor, and we say it is benign. The term is benign. Anorchism. Anorchism. A in front of any term means no or not. Orco means testis. Okay. Ism means condition of. So condition of no testis. It's a genetic issue where the person is born with no male external testes. Okay. Again, the term is anorchism. Anorchism. Androgen. Androgen. Andro means male. Andro means male. Gen means to produce. Male hormones are called androgens. The main male hormone is testosterone. And again, testosterone is a male hormone. It produces secondary sexual characteristics in the male. Facial hair, increased bone density, increased muscle mass, deeper voice. All of these are secondary sexual characteristics associated with androgens. In females, their sex hormones are estrogen and, to a lesser degree, progesterone. They produce female secondary sexual characteristics: breast development, widening of the hip structure, holding on to fat in specific areas of the body. But in males, androgenic hormones, such as testosterone, produce male secondary sexual characteristics. The term is androgen. Androgen. Diuretic. Diuretic. To diurese means to produce urine. The kidneys filter our blood, and what we do not want to remain in the blood leaves the body as urine. The process of creating urine is diuresis. And to produce urine, we would say that a medication maybe has a diuretic effect. It means pertaining to producing urine. So diuretic is pertaining to producing urine. The term again is diuretic. Diuretic. Dermatitis. Dermatitis. Dermato means skin. Itis means inflammation. So it would be red in color, and it would also be elevated potentially due to inflammation. And we might see this in a case of poison ivy, which would be contact dermatitis. Or maybe if you had a new belt buckle and it rubbed up against your skin and left the impression of a belt buckle in red raised welts where your belt buckle had been around your waist. Okay, but in this case, the term is dermatitis. Dermatitis. Endogastric. Endogastric. Again, the stomach is gastro. Endo means within, and IC means pertaining to. So pertaining to within the stomach. Pertaining to within the stomach. The term is endogastric. Endogastric. Arthroplasty. Arthroplasty. Arthro means joint. Plasty means surgical repair of. The term is arthroplasty. Arthroplasty. Glaucoma. Glaucoma is a disease which can lead to damage to the optic nerve. It can lead to increased pressure on the retina. And ultimately, there are multiple types of glaucoma. The most common type, affecting about 90% of the cases of glaucoma, is called open angle glaucoma, in which in the anterior compartment of the eye, the drains that drain the fluid in the anterior compartment of the eye become clogged, and gradually the pressure increases in the anterior area of the eye. We would measure pressure in the eye with a tonometer, but again, the term itself is glaucoma. Glaucoma. Diverticulitis. Diverticulitis. In especially the sigmoid colon, in some cases, the mucosa and submucosa will bulge through the smooth muscle, producing little pockets that we call diverticuli. The condition itself would be diverticulosis. If those pockets become inflamed, either due to infection or whatever the case may be, we would then refer to it as diverticulitis. Okay, again, the mucosa and submucosa layers of the sigmoid colon push through the smooth muscle, creating pockets. Inflammation in that region, we would refer to that as diverticulitis. Diverticulitis. Gastroenterology. Gastroenterology. Gastro means stomach, entero means intestines, logi means the study of. So the study of the stomach and intestines. Gastroenterology. Cystoscopy. Cystoscopy. Cysto is a combining form that means urinary bladder. Scopy means the process of viewing. In this case, cystoscopy would be the viewing of the bladder with an endoscope. Maybe the patient has blood in their urine, they're trying to find the origin of it. Maybe there are kidney stones that may have stuck in the urinary bladder, but the process is called cystoscopy. Cystoscopy. Rosacea. Rosacea is going to be red raised bumps on the face. Okay, they may be on the cheekbones, they may also be on the nose. A lot of times they go across the front of the face. The cause is idiopathic. Idiopathic, of course, means a disease of unknown origin or cause. There are treatments available for rosacea, but again, it is idiopathic. The cause of the disease is unknown. The term is rosacea. Rosacea. Cytoplasm. Cytoplasm. Inside of every cell in our body are structures called organelles, which carry out the functions that that cell was designed to carry out. Maybe it's a mitochondria, which produces energy. Maybe it's the nucleus, which contains the genetic material, the DNA. Maybe it is the endoplasmic reticulum, which packages things produced by the cell to leave the cell. Those are organelles. Everything else we refer to as the cytoplasm. So the liquid portion of the cell, everything not including the actual organelles, we refer to as the cytoplasm. The term is cytoplasm. Cerebral. Cerebral. Pertaining to the cerebrum is the outer area of the brain. That is our supercomputer. Okay, it's going to be divided into the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. Okay, the term again is cerebral. Cerebral. Endosteum. Endosteum. That is going to be within the bone. Means structure. Endo is a prefix that means within. Osteo means bone, so a structure within the bone. The endosteum is going to be vascular connective tissue in the inner medullary chamber of a long bone. Again, the term is endosteum. Endosteum. Hypotension. Hypotension. Hypo means low. In this case, hypotension means low blood pressure. Low blood pressure. The term is hypotension. Hypertension. Hypertension, hyper means excessive or above. Hypertension means high blood pressure. Hypertension means high blood pressure. Again, the term is hypertension. Esotropia. Esotropia. Esotropia is a special type of strabismus. Strabismus means that both eyes are not looking in the same direction. Esotropia is what we typically think of as being cross-eyed. Okay. Esotropia may be intermittent, which means it comes and it goes, or it may be constant. Okay. Again, it's a special type of strabismus which ultimately is going to produce cross eyes. The term is esotropia. Esotropia. Claustrophobia. Claustrophobia. Phobia means fear, and in this case, fear of confined spaces, elevators, for example. So claustrophobia is a fear of confined spaces. Again, the term is claustrophobia. Atrophy. A or an in front of any word means no or not. Tropho means nourishment. Y means pertaining to. So pertaining to no nourishment. Typically we think of atrophy in terms of a patient maybe who has a limb in a cast, and when they take the cast off, the muscles have atrophied. They've gotten smaller in size because there were no demands placed on those muscles during the period when a broken bone was healing. The term is atrophy. Atrophy. Facial, pertaining to the face. Typically, we think of the facial bones as referring to when we hear the term facial. Okay, again, the term is facial. Fluoroscopy or fluoroscopy. Fluoroscopy or fluoroscopy. That's a special type of X-ray that actually allows movements to be observed under X-ray conditions. Okay, the term is fluoroscopy. Fluoroscopy. Epicardium. Epicardium. Epi, of course, means above. Cardio means heart. Means structure. So this is going to be the inner portion of the pericardium, which is the membrane that surrounds the heart. It is going to be on the outside of the heart. So it is the innermost surface of the membrane that surrounds the heart. We could say that it is coinciding with the outside of the heart itself. The term is epicardium. Epicardium. Capsule. Capsule. Capsule may be in terms of delivering a medication through the oral cavity, an ingested capsule. It may also be referring to a structure. For example, the knee joint has a synovial capsule. That means there's a membrane that keeps the synovial fluid within the joint itself. So you may hear the term joint capsule or knee joint capsule if it was referring specifically to the knee. Okay, so there are various terms that could use the term capsule. Okay, but again, the term is capsule. Cardiology. Cardio means heart. Logi means the study of. So the study of the heart. Cardiology. Amnesia. Amnesia. Amnesia is going to be a loss of memory. It could be retrograde after a traumatic event, a psychological trauma, or after a physical traumatic brain injury. All previous knowledge may be lost. That would be called retrograde. Anterograde amnesia means that short-term memory cannot be put into long-term memory. The two can coincide at the same time in some instances, but the term is amnesia. Amnesia. Hemostasis. Hemostasis. Hemo means blood, stasis means to stop. Hemostasis, stopping bleeding. The term is hemostasis. Purpura. Purpura are little red or purple marks on the body, and they are due to very small capillaries just beneath the skin and the dermis layer rupturing. Okay, very small purple or red discoloration then occurs when the blood in those vessels makes its way to the skin surface, because the vessels are in the dermis layer just beneath the epidermis. Okay, the term is purpura, purpura. Heredity, heredity. We typically think of heredity as passing on our genetic material to our offspring. When a male contributes half of the DNA to the offspring and the female contributes half of the DNA to the offspring, we say that the person has inherited these traits from their parents. And so when we think of heredity, we think of passing on our genetic makeup to our offspring. The term is heredity, heredity. Respiratory, respiratory. It could refer to the respiratory system, for example. The lungs and the airway structures associated with the respiratory system. It is going to be responsible for oxygenating the blood and getting rid of carbon dioxide. Okay, the term is respiratory, respiratory. Adrenalectomy, adrenalectomy. If a patient has cancerous tumors on their adrenal glands, one or both of the adrenal glands, since they sit on top of the kidneys and we have two kidneys, we therefore have two adrenal glands. If the patient has cancer of the adrenal glands, one or both may need to be removed. The term is adrenalectomy, adrenalectomy. Anastomosis, anastomosis. An anastomosis is where two structures are connected together. Two structures are connected together. We may have an artery and a vein, and they may be connected by small capillaries, and we would say this connection is an anastomosis. So it's a connection between two structures. The term is anastomosis, anastomosis. Holistic, holistic. Holistic is typically thought of with alternative medicine, using things besides surgery and chemicals to help the body heal. It may be nutrition therapy, exercise therapy, herbal therapy, acupressure, acupuncture. There are a lot of different things that would be wrapped up in a holistic approach to medicine, but the term is holistic, holistic. Anuria, anuria. Okay, an again means no or not. Okay, uria means pertaining to the urine. So in this case, anuria means the kidneys are not producing urine. Anuria means the kidneys are not producing urine. The term is anuria. Meniscus, meniscus. In our knee joint, there are two menisci which cushion the femur as it sits on top of the tibia. So instead of the bones coming right into contact with each other, there's a small space, and these cushions called the lateral meniscus and the medial meniscus that help cushion those bones from coming down on top of each other. The term is meniscus. The term is meniscus. Biomarker, biomarker. A biomarker may be some type of radioactive agent that is traced through, say, the coronary arteries to track blood flow through the arteries that nourish the heart. And so a biomarker would be able to be picked up by a fluoroscope and watched in real time as it moves through the coronary arteries, that would tell the cardiologist if blood is flowing adequately enough to nourish the heart muscle. The term is biomarker. Biomarker. Hypoxia. Hypoxia means low oxygen. If I had a disease of the lungs, like chronic obstructive pulmonary disease, and a patient had an oxygen probe put on their finger for a pulse oximetry reading, their pulse oximetry reading may indicate that they are suffering from hypoxia, a lack of oxygen. The term is hypoxia. Glucocorticoid. Glucocorticoid. That is a hormone that is going to help our body manage blood glucose levels, meaning blood sugar. It's going to be secreted by the adrenal glands, okay, specifically the cortex of the adrenal glands, and help us manage blood glucose levels or blood sugar levels. Again, the term is glucocorticoid. Glucocorticoid. Glycosuria. Glycosuria. That is simply going to mean glucose in the urine. Glucose in the urine. A urinalysis test, a simple dipstick test, would be performed, and that test would indicate if there was glucose in the urine. Okay, that could be a potential indicator that the patient is diabetic. The term is glycosuria. Glycosuria. Anorexia. Anorexia. Anorexia simply means a lack of appetite. After a patient undergoes general anesthesia for a surgical procedure, they may not have an appetite. So anorexia simply means lack of appetite. Anorexia nervosa is a psychological condition where a patient has a form of body dysmorphia where they never think they are thin enough, and they may starve themselves not eating, they may overexercise. But again, there is a difference between anorexia, which just means a lack of appetite, and anorexia nervosa, which is a psychological disorder. Again, the term is anorexia. Onychomycosis. Onychomycosis. Onycho means nails, myco means fungus, and osis means condition of. So it's a condition of fungus of the nails. Okay, a condition of fungus of the nails. It may cause the nails to become thickened and very brittle. Okay, the term is onychomycosis. Onychomycosis. Chiasm. Chiasm. Chiasm, and specifically one example in our body is the optic chiasm, where the optic nerve from the right eye crosses over to the left side of the brain and vice versa at a point called the optic chiasm. Okay, the term is chiasm. Chiasm. Latissimus dorsi muscle. Latissimus dorsi muscle. If we break the term down, it literally means lateral muscle of the dorsum. The dorsum is the back, so it's the back muscle on the outer sides of that region. Lateral muscle of the back. The term is latissimus dorsi muscle. Anaphylaxis. Anaphylaxis is a type 1 hypersensitivity. In some cases, it's due to a bee sting or bug bite. It could also be due to a food allergic reaction, a latex allergy. It can, in severe cases, lead to respiratory distress and then ultimately respiratory arrest. In most cases, it's just hives or red inflammation. But in some cases, again, it can lead to respiratory distress and respiratory arrest. It's typically countered with epinephrine. But the term is anaphylaxis. Anaphylaxis. Prednisone. Prednisone. Prednisone is a medication used in many applications in the healthcare field. Oftentimes it's used with diseases where inflammation is produced, like the airways and the lungs that have inflammation. Prednisone would be given to try and restore normal air movement in and out of the lungs. But it also might be used in cases with patients that have rheumatic conditions like rheumatoid arthritis, or in patients that may have systemic lupus erythematosus. Those are also conditions where prednisone may be used. In patients that are receiving organ transplants, it may be used to suppress the immune system. But the medication is prednisone. Prednisone. Cerumen. Cerumen. Cerumen is earwax produced by cerumen glands in our external auditory canal. The term is cerumen. Malleus. Malleus. The malleus is one of the internal auditory ossicles of our middle ear, and these are instrumental in our ability to hear because the three auditory ossicles, the malleus or mallet, the incus or anvil, and the stapes or stirrup, perform what's called bone conduction, and this bone conduction creates stimuli that gets picked up by the cochlear nerve and ultimately gives us the perception of hearing. The term is malleus. Malleus. Carcinoma. Carcinoma. Carcino means cancer, oma means tumor. So this is a cancerous tumor. Carcinoma. Carcinoma. Angiography. Angiography. Angio means vessel. Okay. In angiography, we are going to take a picture of the vessel. And ultimately, in most cases, we're talking about the vessels which nourish the heart muscle. The cardiologist can inject a contrast medium or biomarker, and that allows fluoroscopy to be used to see about the flow of blood through the coronary arteries that nourish the heart muscle. Okay, the term is angiography. Autologous. Autologous. Autologous would be referring to a self tissue. Okay, if for example I was burned severely and they did a graft from one area of my body to the area where I was burned, we would say it was an autologous graft. An autologous graft. Auto means self, so autologous. Autopsy. Autopsy. Okay. Opsy means view. Auto means self. So in this case, the person is going to be viewed after their death. Okay. In some cases where foul play may be expected, like a murder investigation, or if a person dies for no good reason, an autopsy may be performed. Okay, again, the term is autopsy. Affect. Affect. In some instances, like in Parkinson's disease, you may describe a patient as having a flat affect. Affect deals with emotions, and when you look at a patient with Parkinson's disease, their face would have a flat affect. It doesn't show emotion. It has the same look on it at all times. So we might say that the patient with Parkinson's disease has a flat affect. Okay, again, the term is affect. Hemorrhage. Hemorrhage. Hemo, of course, means blood. Rage means bursting forth. So bursting forth with blood. The term is hemorrhage. Hemorrhage. Graft. Graft. Okay. In this case, graft could be an isograft, where we take tissue from an identical twin, an allograft, where we take tissue from another human donor, not a twin. It could be an autograft where we take our own tissue, or it could be a xenograft where we use tissue from another source, like a pig valve, for example. But the term is graft. Incontinence. Incontinence means to not be able to hold urine output. Okay, the patient cannot urinate when it's appropriate, and they may go in the middle of the night or they may go during the day, but regardless, they are not able to control when they urinate. The term is incontinence. Incontinence. Cholesterol. Cholesterol. Cholesterol is produced in the liver and also other intestinal structures, and it is going to be essential for every cell in our body. Every cell in our body is made up of cholesterol. Okay? The body can, in some cases, produce too much cholesterol, and that can lead to blockages, especially in the coronary arteries, which could lead to a heart attack. But we can also see blockages in the periphery as well, which would be called peripheral vascular disease. But the term is cholesterol. Cholesterol. Adenocarcinoma. Adenocarcinoma. Adeno or adeno means gland. So this is going to be a cancer of the glands. Glands are made up of epithelial tissue, so you could say that an adenocarcinoma is going to be made up of epithelial tissue and affect the glands of the body. The term is adenocarcinoma. Pleurisy. Pleurisy. Pleurisy is going to be an inflammation of the membranes which surround the lungs, which are called the pleural membranes, and attach to the thoracic wall. Okay, it could be due to some form of pathogen. It could also be due to pneumonia. It's going to lead to difficulty breathing. It might have a sharp stabbing pain, and if it's due to some sort of a pathogen infection, there may be coughing and a fever associated with it as well. The term is pleurisy. Pleurisy. Surfactant. Surfactant is going to be a lipoprotein produced by the alveolar cells of the lungs, and it is going to lubricate the tiny air sacs of the lungs, which allow them to fill up with air and then contract, so normal breathing is allowed, thus getting rid of carbon dioxide produced by metabolism in all of the cells of the body, and taking in oxygen and getting it into the bloodstream. Okay, so surfactant is going to increase pulmonary compliance, the ability to expand and contract. It's also going to reduce the risk of a collapsed lung, which is called atelectasis. That's where the alveoli stick together and can't expand. So this is going to be secreted among all of the alveoli, and it's going to be made up of protein and fat. The term is surfactant. Surfactant. Addiction. Addiction. Addiction is going to be a psychological disorder in which, despite the patient knows there are problems associated with their actions, they still will go ahead through with these actions due to the immediate euphoria that they get from those particular actions. It may be taking a drug and the euphoria that they quickly receive from taking the drug. It may be gambling, the euphoria that they get when they place their bet. But addiction can be psychological and physical. Sometimes physical addiction means the body gets to a point where it has to have something such as a drug, and maybe it's something as common as caffeine. If it's physical addiction, then it would lead to withdrawal. Okay, in this case, it's physiological addiction. Psychological addiction, the patient may need that euphoria they get from doing some sort of an act or taking some sort of a drug. Again, the term is addiction. Addiction. Anoxia. Anoxia means severe lack of oxygen. If I am underwater, for example, it's in the middle of winter and my car goes off of a bridge and I'm underwater and they can't get to me, I would have anoxia. My tissues would be suffering from a severe lack of oxygen. Anoxia. Humoral immunity. Humoral immunity. The humors of the body are the body fluids, and that's where we would find things such as complement protein and antibodies. And that is going to be associated with our body's ability to fight off foreign pathogens. Viruses, bacteria, prions, fungi, parasites. So these are going to be located in the fluids of the body that we would refer to as the humors. So that's why we call it humoral immunity. Again, the term is humoral immunity. Angiogram. When angiography is performed, a biomarker or radioactive isotope is placed in the vessels that surround the coronary, or excuse me, that surround the heart, the coronary arteries. The picture that is produced, or the X-ray that is produced, is called an angiogram. Angiogram is the term. Pyrexia. Pyro means fire. So pyrexia would be a fever or producing fever. So the term is pyrexia. Nasopharynx. Nasopharynx. Naso means nose. In this case, it's referring to the nasal cavity. Pharynx means throat. Now, we also have an attachment with the oral cavity to the pharynx. In that case, we would say it's the oropharynx. But in this case, our term is nasopharynx. Nasopharynx. Cyanosis. Cyanosis. Cyano means blue. Osis means condition of. Condition of being blue. In cases of hypoxia, the patient may have a bluish tinge of their nasal membranes, their lips may be blue, and if it is severe enough, they may also have peripheral cyanosis. That means throughout the rest of their body, they are also blue in color. Their fingertips, for example. Okay, the term is cyanosis. Cyanosis.